Hello guys, I am Dr. Prateek Joshi. Today we have a case of a young individual with lateral meniscus, anterior horn and body tear leading to parameniscal cyst formation. As you can see on the diagnostic arthroscopy, there is complete tear of the anterior horn and the body of the lateral meniscus at meniscocapsular junction. So this kind of tear leads to extravasation of the synovial fluid into the subcutaneous plane leading to parameniscal cyst formation. So you can see there is a huge defect between the capsule and the meniscus. Once we do the repair of this tear, this defect should obliterate, and in this region of the meniscus which is vascular, we anticipate good healing potential of the repair that we are going to do. So now I am going to use arthroscopic shaver to remove fibrotic tissue in the defect. This is also going to facilitate bleeding in this region, which is going to increase chances of healing of the repair that we are going to do. This is also going to decompress the parameniscal cyst to some extent. However, after repair of the meniscus, obviously the parameniscal cyst is going to get obliterated. In such anterior tear of the meniscal tissue, the outside in technique is ideal to repair the meniscus tear. So here I am going to pass a loop of number 20 ethylone through the tissue of the meniscus. I am going to take the medial most suture through the substance of the anterior horn of the lateral meniscus, and through this loop of the ethylone I am going to shuttle number 2 fiber wire, and again I am going to repeat this step to complete the horizontal mattress suture configuration for meniscus repair. By mattress configuration I mean that both the sutures will pass through the substance of the meniscus, and if you pass one suture through the meniscus and other suture through the capsule, then that means a simple configuration of the repair. So as you can see, I have passed both the limbs of the number 2 fiber wire through the substance of the meniscus in horizontal manner. So this completes our first stitch, and now I am going to use inside out device for the stitch which we are going to pass through the body portion of the lateral meniscus. So as you can see, I have introduced the cannula for inside out suture device, and I have passed the needle through the meniscus tissue. My assistant is going to pull out the needle from outside, and then I am going to introduce the cannula again and pass the second suture through the meniscus tissue. So this completes inside out suture taken through the body, and now I am going to take another suture by outside in technique through the anterior horn of the lateral meniscus, just medial to the inside out stitch that we had taken. Here also I am going to use horizontal mattress configuration. It is important to keep some distance between the stitches. The distance should be at least 5 mm so that there is no cut through. For this outside in repair, I am using the spinal needle to shuttle the fiber wire through the meniscus. So this completes the second outside in suture. So till now we have taken two outside in suture and one inside out suture. Now I am going to visualize this suture through the defect. There you can see the blue thread is the inside out suture, followed by the outside in suture number 2, followed by the outside in suture number 1. Now I am going to take another final outside in suture through the anterior portion of the lateral meniscus. Here I am taking a simple stitch, which you can make out that I have pierced the capsule but I haven't pierced the meniscus tissue. So I am at the superior end of the meniscus. So the first stitch is passed superior to the lateral meniscus, and now I am passing the second suture through the substance of the meniscus. So this will be simple configuration of the suture. which we are going to pass through the anterior horn of the lateral meniscus. Once we have passed all our threads outside the knee joint, then we are going to start the knot tying process. So as you can see, I am using SMC knot to tie our sutures. I am using knot pusher to sit my knots as deep as possible, and we should be very careful not to pull too much or not to push too much because these are very small diameter threads. Last thing you want is that the thread gets cut, and then you will have to repeat all the steps all over again. Before tying the knots, we usually put incision between the two threads, and then we shuttle the threads through the subcutaneous plane inside the incision, and then we tie the knots as you are seeing in this video. Usually we run 5 to 6 knots and then we cut the threads flush. So this is the final picture after the repair of the meniscus tear. Now you can clearly see that the anterior horn and the body portion of the meniscus is sitting very nicely adjacent to the capsule. There is no space whatsoever between the capsule and the meniscus. So we could do good repair in this case. We have used 3 outside in sutures and 1 inside out suture, and this is going to have good healing potential and good results for this patient in long term. Thanks for watching this video. Do like and share the video. Subscribe to the channel. If you have any queries, you can ask in the comment section. Thank you.